Hello, this is Rabble Radio, recorded on Friday, May 9th, 2025. I'm Brianne Doyle. rabble.ca shares with you the news of the day through a progressive lens. If you're curious about what's happening in Canadian politics, labor, the environment, and beyond, you've come to the right place. This is news for the rest of us. Thanks for tuning in. As of April 2025, COVID-19 has claimed the lives of at least 7 million people globally. The true toll is likely even higher as many countries have stopped reporting reliable data. Without clear data, it can feel like the pandemic is behind us, but that perception is far from reality. For disabled people and for those living with long COVID, the crisis is ongoing. COVID remains a serious, disabling, and deadly threat. This week on Rabble Radio, rabble.ca's Jack Layton Journalism for Change fellow Ashleigh-Rae Thomas spoke with Fatima Adam about what COVID realism is and how it's connected to disability justice. Here are Ashleigh-Rae and Fatima in conversation. Take a listen.
Thank you so much for joining us today on Rabble Radio, Fatima. Could you tell me a little bit about yourself, who you are and what you do?
Yes. Hi. Thank you so much for having me. My name is Fatima Adam. I am a Toronto-based writer, arts administrator, and facilitator with a focus on disability justice and COVID realism.
Thank you so much. You describe yourself as someone who is into COVID realism. Can you describe what that means?
Yeah, so COVID realism is a term that I've pretty recently just heard of, and I prefer using the term COVID realism over COVID cautious, because to call yourself cautious is to almost have an implication of like doing too much, like you're being over dramatic or you're going beyond what is necessary, when in reality, those who are considered COVID cautious are actually just taking the safety measures that are needed for the level of risk that we are being subjected to. It's the fact that folks who aren't COVID cautious are not taking those measures, and in fact, not just endangering themselves, but also us, that we have to take those measures. So it seems like we're being cautious when in actuality, we are just acknowledging the reality of the situation rather than just pretending like none of this is happening and taking no safety measures whatsoever. So I call myself a COVID realist versus someone who's COVID cautious.
I think that's a very fair thing to say, because for the past few years, we've been seeing like our government, our healthcare systems, and the media pushing the idea that the pandemic is over. So it seems like those of us who are COVID cautious or COVID realists are in the minority. Why do you think that is? And what do you say to people who tell you that the pandemic is over?
Well, COVID denialism, like most things that harm us in our day-to-day lives, goes back to capitalism. Being COVID cautious or being a COVID realist is something that causes corporations money. If you are, taking precautions, as in you're testing regularly, you're social distancing, you're not going to in-person activities like being at work or shopping, then the people who own those things, for example, corporate real estate, they're going to lose out on that because those offices are sitting empty. That's why the push to go back to the office was so strong, despite the fact that for about 2 years, we displayed the fact that, we can actually work from home quite well. And there's quite a lot of mental health and physical health benefits to it, as well as it being more economically viable, people being able to spend more time with their loved ones, having more flexibility over their scheduling. There were so many benefits to work from home being something that, well, first of all, is an accommodation that disabled people have been asking for a very long time. And prior to COVID, we're told that it was not possible. However, as soon as the yet to be disabled population, I don't call people who are not disabled yet not disabled, I say yet to be disabled, because we will all eventually become disabled through aging or through illness. The yet to be disabled population, as soon as they were impacted, all of a sudden, we can do everything on Zoom. We can have work meetings on Zoom. We can have work parties on Zoom. We can have DJ sessions on Zoom. We can have a New Year's Eve party on Zoom. We can have a funeral on Zoom. We can do all of these things that for years and for decades when disabled people were the only ones advocating for it, we were told it was impossible. As soon as the general public is in need for it, and in the same way, as soon as the general public, or rather the not yet disabled, no longer cared about taking COVID precautions, those things went away. So in the same way that the intense lowering of quarantine days by the Delta Airlines CEO has nothing to do with science or facts or any aspect of reality, and everything to do with making sure that there are as many people in airplane seats as possible and as many flight attendants on the planes as possible. The same thing happened with the rolling back of measures. So what I'm referring to is the fact that in the United States, the CDC about in 2022, after the Delta Airlines CEO wanted quarantine to be a shorter amount of time because of the impact that it had on the airline industry, they shortened it from, I believe it was 14 days to then 10 days to then 5 days, none of which is backed up by facts. The World Health Organization still recommends a 14-day quarantine today in 2025, but that didn't matter. That the facts of the matter were irrelevant. And that's why I say that I'm a COVID realist, because to do something like that is to not live in reality, is to not see the level of harm that is surrounding you, or at the very least to not care about it and how it impacts you.
And then, so you talked about disability being something that happens to everyone eventually. And so with that in mind, I still mask when I'm outside, and I still mask around people that I don't know, because I don't want to catch or spread COVID or develop long COVID. And a lot of people are not aware of what long COVID is and how damaging it is to your body. So can you describe what it is and what some of the known symptoms are?
Yes. So long COVID is a post-viral illness, which means that it is an illness that you get after you have experienced a viral infection like COVID. And because of how new it is yet to be understood. There is no long-term treatment for it. There are long COVID clinics that are trying to help people as best as they can. However, the breadth of symptoms and the impact of those symptoms is so vast and so negative that it's almost it's a little terrifying. So when people tell me like, oh, I mask because I don't want to get long COVID, I'm like, oh, absolutely same. Neither do I. So like some of the symptoms of long COVID, things like brain fog, dizziness, difficulty swallowing, heart palpitations, POTS, diarrhea, joint and muscle pain, weight loss, skin rashes, abdominal pain, lack of appetite, chest pain, anxiety, taste and smell changes. And these aren't things that are just like an acute thing, like you have it for 1 or 2 weeks. Like, no, there are folks who have been dealing with this for years. There are folks who are unable to go up a set of stairs without being deeply out of breath, folks who are bedbound, folks who are living a fraction of the life that they used to be able to live because they got COVID. And so long COVID is essentially, if I were to give it a sort of TLDR, it is a post-viral illness that is yet to be understood because the vast array of symptoms, I think there's over about 200 symptoms that have so far been identified with long COVID, as well as just how impactful they are, just how painful they are, just how long lasting they are, is why anyone who is being realistic, who is acknowledging facts and reality, would not want to get COVID and would mask and would take precautions.
So with society just deciding the pandemic is over and moving on, we've seen a lot of erosion of rights of disabled people, of people's rights to wear masks, of people's rights to be vaccinated, like to listen to science. We've seen a lot of, like you said, COVID denialism. How does that play into what disability justice is? And like, what is disability justice and how does it affect COVID realism?
So to understand disability justice is to understand the transition from disability rights to disability justice. So disability rights was the movement to get civil rights for disabled people, to be able to work, to be able to go to school, to be able to live in society amongst not yet disabled people, because this was not completely in every single like state. I'm specifically talking about the United States, but there were these things called ugly laws in which disabled people were essentially barred from leaving the house unless they were used for entertainment or to disgust people, because they were seen as having a condition or a life that was so horrid that they simply could not be around the general public. And so the movement for disability rights was to get the basic standard of acknowledging that someone is a human in place. And then the shift from disability rights to disability justice is acknowledging that yes, we are able to be in the same workplaces as not yet disabled people, but we are allowed to be paid less than minimum wage. Yes, we are allowed to go to the same hospitals as not yet disabled people, but in the case of there being a scarcity of supplies, we are more likely to be overlooked because, oh, well, we're already sick anyway, so you probably have a higher chance of, not making it or dying or things like that. And so I would say that the kind of like first step of anyone delving into disability justice is SIN's Invalids 10 Principles of Disability Justice, seeing as they are the collective who kind of coined the term and really pushed for it. Mia Mingus in particular, who is a member of that collective, made a post saying, you are not entitled to our deaths, and essentially talking about the way that COVID denialism has not only pushed disabled people out of public life, but it has also increased the amount of harm that we have simply just trying to get basic tasks done. And so the connection between disability justice and COVID cautiousness or COVID realism is that in order to be someone who cares about the liberation and the removal of subjugation of disabled people, you have to acknowledge that not only is COVID a mass disabling event, but people who were already disabled pre-COVID are in an even worse position because their already precarious health is being threatened with being made worse. And anyone who has a chronic illness and has tried to navigate Ontario's healthcare system will tell you that you could have a condition that's been around for 5 years, 10 years, 20 years, 30 years, and still be misdiagnosed, misunderstood, not listened to. And so to get something like long COVID, which has only existed for a couple of years, which does not have a whole lot of, research behind it in terms of treatment or any type of like cure for it, it's terrifying. And it's essentially the social murder of disabled people. So the connection between disability justice and COVID cautiousness or COVID realism is that in order to be COVID cautious is to acknowledge that not only do you not want to get yourself sick, not only do you not want to get other people sick, you do not want to sentence disabled people to isolation or death.
What do you mean by social murder of disabled people?
So social murder refers to the social model of disability. So there's the physical health model of disability, meaning the ways in which your physical health condition disables you, the functions that you struggle with, the abilities that you may or may not have. And then there are the aspects of your life that disable you, not because of your health condition, but because of the lack of access and the barriers the society in which you live in places upon you. So for example, I would say one of the most common and yet very under discussed accessibility tools is glasses. So for example, you and I are both wearing glasses. We both have vision impairment. We are able to go to any optometrist or like any online store and get a mobility aid, an accessibility aid, a health tool that ensures that we are able to see and live our life without going through a very arduous process of paperwork and proving that we need this and having to get doctor's approval and waiting months and getting specially fitted. That is an example of a social barrier that has been removed because of the widespread access of glasses and contacts and corrective vision devices. And so the social model of disability, which is what I refer to when I say social murder, is the implementation of policies or informal laws, societal rules that essentially put disabled people at harm's way. So for example, mask bans would be an example of social murder because whilst you are not directly pulling a trigger or stabbing or killing a disabled person by doing so. When you ban masks from public spaces, you are essentially not only saying that disabled people cannot come into these establishments and reverting back to a form of the ugly laws, you are also creating super spreaders. You are also creating petri dishes for COVID to continue mutating and getting new variants and continue living and festering and making this pandemic longer and longer.
And so you also mentioned like the erasure of disabled people. So it feels like society has like moved on and left disabled people behind. And so some disabled people from like what I'm seeing online are like feeling erased from society. Can you explain a little bit what that means?
Yes. So I have a pretty unique perspective in this as someone who used to work in theater and is Black. I know people can't see me, but I am Black. And there's something in theater and live performances called Blackout Night. And it was started by Jeremy O. Harris, who was the playwright behind Slave Play. And essentially what it is productions that are a predominantly Black cast, directed by a Black director, written by a Black playwright. In other words, by Black people for Black people. And the concept of that night is that it is an explicit invitation to Black people to come to the theater, to fill up the audience, because theaters and places like operas are venues that have been kind of implied that, oh, this is not a place in which Black people, quote unquote, belong, or that, this is not a Black community spot. And so Blackout Night is an explicit way of saying, actually, no, you do belong here. This is your space. This is your night. And I fully support Blackout Night. And some of my favorite performances of shows have been, like, I've seen the same production twice, once on Blackout Night and once on a regular day. And Blackout Night is always better. But the thing that I have noticed, which has kind of just boggled my mind, is that not only have most theaters just abandoned all COVID safety measures, but the few that do have COVID safety measures will do this very odd thing in which they will have a Blackout Night performance and they will have mask required performance, but nary the two shall meet. And so what that's communicating to me is your idea of a Black community event, your idea of Black people gathering and being in space with one another and having a good time is exclusive of disabled people. So your definition of community for Black people does not include Black disabled people. And on the flip side, you've got mask required nights where it's just anyone who's just wearing a mask. And so essentially you're being told you can be in this space as a Black person, you can be in this space as a disabled person, you cannot be both. And so essentially what it does is the shrinking of disabled people's lives as COVID safety measures have been removed has been quite severe. People have, had to switch careers, had to switch academic paths, lose friendships, cut off family members, because there's no way of, there was this article from a couple of years ago, I think it was either 2016 or 2017, and I'm paraphrasing the title, but essentially it was, I don't know how to tell you that you should care about other people. And I feel like that is in hyperdrive right now, because it shouldn't take, government mandated requirements for you to not want to harm people that are already marginalized, that are already vulnerable, that are already dealing with a lot. And so when places don't have any mask requirements, don't have any, air purifiers, don't have any social distancing, don't have any testing, it's essentially a giant banner saying disabled people not welcome here. The people who are running these events may not realize that that is what they are saying, but disabled people very much feel that.
It's interesting that you brought up that article from a few years ago about, I don't know how to tell you, but you have to care about other people. It feels like, quote unquote, post-pandemic, we've become more individualistic and more okay with sacrificing, quote unquote, disabled people for the greater good. Again, quote unquote. What do you think about that?
I think that is an accurate observation. I think when you spend years publicly declaring that an entire demographic of people are disposable, that's going to lead to a lot of apathy. That's going to lead to the average person's moral conscience kind of tilting a little because they have seen mass death and disablement over and over again every single day. And the powers that be, the people, the institutions, the politicians who can help this are saying, well, actually, it's totally fine if this group of people dies. And I think it was a member of the CDC who had said, oh, it would be when they were announcing essentially that COVID was now endemic, and you can't see it, but I'm using air quotes. It said that about 200,000 people would die every year, but it's okay because those folks were probably disabled anyway. And then just moved on like that wasn't an absolutely egregious thing to say. Like
eugenics.
Yeah, exactly. Like it's sacrificing nearly 250,000 people every single year so that you can continue dining indoors is a moral equivalent, a moral dissonance that I just cannot comprehend. And then that's what I mean when I say COVID realism, because in order to get to that level of thinking, you have to deny reality. You have to deny not just reality, but also empathy. And you have to deny humanity, not only the humanity of others, but also your own humanity. In order to be a monster to others, you first must allow yourself to become a monster. And I'm not saying that not yet disabled people or folks who are not COVID cautious or COVID realists are monsters. I'm saying that they have allowed themselves, whether or not they're conscious of it, to sacrifice an entire demographic of people, a very large demographic, mind you, for their own comforts, to continue living life as quote unquote normal. And that is eugenics. That is a level of moral depravity, of selfishness, of cruelty that I think the average person would not associate themselves with. And yet that's what their actions are conveying. Going back to the realism point, you have to deny reality.
We're wrapping up here, but if someone listens to this episode and decides, okay, I want to practice COVID safety, I want to be more realistic about COVID, what is some advice you'd give them and where should they start?
I would say the first place I would go is covid.tips. That is the website URL, covid.tips. And it is essentially a very long resource called How to Talk to Your Loved Ones About COVID. And in this resource, it's essentially, I would like people to see themselves as the loved one in question, because it asks every hypothetical question that somebody who is thinking about taking precautions again would have. And then another one, I'd say starting even before that would be, once again, Sin's Invalid, I love them, their Crip Crash course, which is a 3-day email course. So for 3 days in a row, they email you a set of resources and you sort of like do a little activity or lesson. And it's a launch pad for getting yourself into disability justice. There's also a disability syllabus document that I can share with you. And it has an intro to, short form works of, basic definitions of disability justice, all the way to like long, heavier text with a lot of academic jargon. And I think that this launchpad, these three things, COVID.tips, the Crip Crash course by Sin's Invalid, and then the disability syllabus gives people a really great starting point in, wanting to be more cautious of COVID, wanting to practice COVID safety. And then what I would do immediately afterwards is look up if your city has a mask block or a safe air collective, because getting a mask that fits properly, getting a mask that is comfortable, that you can wear for a long period of time is of paramount.
Okay, Fatima, thank you so much for all this information. I hope that everyone who is listening will go out and get some fitting masks. Thank you so much.
That was Fatima Adam and Rabble's Jack Layton Journalism for Change fellow Ashleigh-Rae Thomas. Thanks so much for that, Ashleigh-Rae and Fatima. And now, this is our In Case You Missed It segment, where we review the top stories from this week on rabble.ca. For that, I'll turn things over to Rabble editor Nick Seabrook. Over to you, Nick.
Thanks, Brianne. Starting with national news. The federal NDP have chosen an interim leader. Vancouver Kingsway MP Don Davies has been selected to be interim leader of the NDP until a leadership race can be held. Davies has been a Member of Parliament since 2008 and won re-election to a fifth term in the House of Commons on April 28th. This past federal election saw a drastic reduction in the number of elected NDP MPs. The party lost 18 of its 25 seats in the House, leaving them with just 7 seats. Davies said that one of his priorities as interim leader was to rebuild the NDP's coalition of support, saying, quote, "The strength of the NDP has always come from our members, activists, Labour, and supporters. I look forward to working with our caucus, our party, progressive allies, and everyone ready to build a stronger, better, fairer Canada for everyone." End quote. In Labour news, unionized workers in the film industry in the US and Canada are reacting to US President Donald Trump's latest threat to place a 100% tariff on all films not made in America. The Alliance of Canadian Cinema, Television, and Radio Artists, which represents many film workers in Canada, said that such a tariff could be devastating to Canada's film industry and economy. The film industry contributed over $11 billion to Canada's GDP in the 2023-2024 fiscal year. The union also warns that the mere threat of tariffs could disrupt or shut down some productions, as well as harm the long-standing partnerships between Canadian and American film workers. In other news, the UK Supreme Court recently made a ruling excluding trans women from the legal definition of women. The decision led to an immediate outcry in the UK, with trans rights groups organizing a protest that saw over 20,000 people take to the streets of London last month. Rabble spoke to 2S LGBTQIA+ rights groups in Canada who were equally outraged by the decision, and they pointed out key differences between Canada and the UK when it came to trans rights. Faye Johnstone, executive director of the 2S LGBTQIA+ advocacy group Queer Momentum, in an interview with Rabble, said, quote, "Trans inclusion is not a question mark in Canada's feminist movement. It is a foregone conclusion. We recognize that patriarchy impacts women, be them cis, trans, and impacts gender minorities of all kinds." End quote. As always, you can read the full version of all the stories we talked about today on rabble.ca.
Thanks, Nick. And that's it for Rabble Radio this week. Thanks as always for tuning in. If you like the show, please consider subscribing to Rabble Radio on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. Thank you to all the journalists and writers who contributed to this week's content on rabble.ca, and thank you to Carl Nirenberg for supplying the music. Lastly, thank you to you for tuning in to Rabble Radio. I'm Brianne Doyle, and I'll talk to you next week.